Hi, good evening everyone. This is Mr. Ali and Adrian Berman in the Biomechanix clinic. Today we're about to do a program online, webinar, teaching and training ultrasound skills. But we thought we'd spend a few minutes just talking to you guys about what ultrasound can do, because Joe Public's not always fully aware of the ins and outs. We always talk about it very clinically, but what in layman's terms can we do with ultrasound scanning? Today we'll just talk about the shoulder, the elbow, hand and wrist. So Adrian is a highly experienced and highly skilled sonographer. He's been scanning for how many years, Adrian?
15 years now.
15 years, so he's picked up a lot of tricks along the way. I've known him for a long time and we work together very closely. He's got more knowledge than he can talk about. Adrian, give us some examples please for Joe Public out there. Somebody's got pain in the shoulder, they've been to the GP, the GP's given painkillers, they've given them some exercises to do. If they're really lucky, maybe they've seen a physio, or otherwise, say for example they've got a painful shoulder, they can hardly move it, it's giving them all day long pain, all night pain, miserable way of life, they can't do normal functional activities, even just brushing your hair or wiping your backside even, it can be really difficult. Yeah. What could you do with your ultrasound scan to help diagnose what's going on in that shoulder?
Well, it's a very common injury, the shoulder, and problems with the shoulder, and it's a dilemma if you haven't got any imaging. It's a dilemma for the physios or the doctors to work out what is actually going on. Is it a frozen shoulder? Is the shoulder stiff and it's because it's frozen, or is it more serious? Is it more tendon tear? And things like that. So ultrasound can help differentiate those sort of pathologies.
How about if it's arthritis in the shoulder?
Yeah,
you can pick that up on your scan?
Yeah, you can pick up all those.
Inflammation, if the shoulder's really inflamed and swollen inside, you see that? All
those things you can pick up.
It's really clever stuff.
Yeah. And
people think that MRI is the gold standard, but it's surprising how much information you can get with an ultrasound scan. Yeah. And the interesting thing always is that you can see in real time what Adrian's doing, so he can show you through the different structures in your shoulder and show you exactly where the problem is. Yeah,
and it's quite a common thing with MRI. People don't like the confined space going through the tunnel and things like that. Plus you have to remain really still to get a decent image. Whereas ultrasound, we can move the joints and scan in real time, so we can see the tendons moving, we can see how the joint moves, we can apply stress to the tendons and the muscles, and see how all that reacts under ultrasound and hone in on the diagnosis.
Adrian, what's the most common problem you've seen in all your years of scanning shoulders? What's the most common thing? Is it tendon problems? Is it frozen shoulder? I mean, arthritis in the shoulders? What do you think is the most common cause of that type of shoulder problem we discussed earlier?
Yeah, I think the most common thing is something called subacromial bursitis, or impingement syndrome, it's sometimes called. And that can either be you've got an inflamed tendon and it's impinging on the bone just here, or it could be what we call an inflamed bursa, which is a normal bit of anatomy. It just becomes swollen, and the space that it moves just pinches in there. So it's probably one of the most common things. It's one of the things that gets mixed up a little bit with frozen shoulder, because you lose that range of movement. So ultrasound can help distinguish that. You can pick up little subtle keys for frozen shoulder, but it's more of a clinical diagnosis, frozen shoulder. But ultrasound can help differentiate the bursopathy, the bursitis, when they get a bit, it's one of those, they've got the hand in both camps sort of thing. But it's not just the shoulder. You can look at things like the elbow and the wrist. You've got your tennis elbow, you've got your golfer's elbow, you've got nerves that you can look at.
And that's the tennis elbow is what, pain on the top of the forearm?
Yeah, on the sort of lateral epicondyle.
So about here.
The elbow, and it's that.
Just sort of around the crease of your elbow here.
That's exactly.
They can often feel swollen, and the pain you get is when you're trying to extend and flex your arm. Even simple things like picking up your cup of tea or drink, driving, of course.
Yeah, gripping things can be really painful. It's quite hard to grip things.
And then with ultrasound you can see exactly what the problem is, and usually it's a tendon problem there.
Yeah, usually you can look at the tendon, you can see if there's a tear there, or you can see if there's any tendinosis, which is basically just inflammation to that tendon. And again, you can apply that on on the medial inside aspect of your.
So there we call that a golfer's elbow.
Golfer's
right?
elbow, exactly right. Yeah. So,
And same again. There's a tendon and some ligaments here.
Yeah.
We can have a look inside, and sometimes again it could be arthritis in the actual elbow joint because that's pretty close. Yeah.
Yeah.
You can have inflammation. You can have all different types of arthritic problems, rheumatology, etc. And all that can be picked up really nicely with the ultrasound, I believe.
Yeah, you can even you get weightlifters come in and they've just lifted something too heavy and they've ended up rupturing something called the distal biceps tendon, and you can pick up all those sort of injuries as well.
Yeah.
On the
How
wrist.
about the wrist? Yeah, wrist and hand. Then I mean, is that a common cause of referral for you? Do you see many wrist and hand things coming through to your clinics?
Wrist things tend to be like little lumps and bumps, little ganglions that you can pick up. You can scan those very well with ultrasound. You can hone in on which joint they're coming from. Quite a lot of rheumatology things. You can look at the joints and how they're behaving with different stages of rheumatoid arthritis. You can see